Antimicrobial stewardship is something that's important, I think, for two major reasons that are probably pretty obvious, but something worth discussion nonetheless. The first reason with antimicrobial stewardship is, obviously with these bugs, critters, bacteria, whatever, with everything else that's living, they're going to evolve with time. So we run to the issue of antibiotic resistance. And so we're always kind of looking at things from a perspective as we need to try to manage this as best as possible so that we can kind of keep the rate at which antibiotic resistance develops, keep that rate as slow, or keep that progression as slow as possible, so that we can always have effective means for treating any kind of bacterial infections or viral infections. So that's a big thing, I think. The other big issue with antimicrobial stewardship is kind of related to the first point, but that is making sure that we only medicate the patients with antibiotics as needed. So if we have a situation where antibiotics are of no benefit to the patient, then let's not use them. Let's not overprescribe them when they're not needed. One thing is, obviously, that helps combat or helps us to mitigate some of the antibiotic resistance that's going on. Another thing too is saving money. Not that everything about the hospital and the medical industry is about that, although it is a big point, but there's no point in giving if it doesn't benefit the patient, then why use our time and resources? So we're thinking of, we have the cost of the antibiotics given to the patient. We have the cost of the blood cultures associated with that. We have the time associated with the lab having to go and stick a patient twice to do cultures on them. So if there's no benefit, then let's not waste our time and money on it. So to me, those seem like the two big things that are worthwhile as far as keeping an eye on who we give antibiotics and antimicrobial stewardship.